Welcome to Section 2 of Chapter 3. Know your data sources.
When it comes to contracting, the data sources that you'll most often use are the RBRVS, the Resource-Based Relative Value Study, and the Medicare Fee Schedule. The Medicare Fee Schedule is actually based on the RBRVS. Some health plans will use a percentage of Medicare, so 110, 120, 130% of Medicare, whatever. Some plans use a calculation based on the RBRVS. Keep in mind, both of these change every year. They actually change within the year subtly. So you're going to want to really pay attention to the year of either RBRVS or the Medicare Fee Schedule to make sure that you can calculate what the reimbursement will be.
We recommend that you keep copies of your commercial contracts on file so you know what your reimbursement is. You can request copies of your contracts directly from the payers, and we will give you more information on who to contact in the next chapter. If you are part of a larger organization, like an IPA, you may reach out to the contracting team to ask for your contracts through them.
So let's say your contract is based on the 2014 Medicare Fee Schedule. That's something you can look up. It's online. You can get it for free. No problem. If your contract is, again, just making up numbers, let's say your contract is 120% of Medicare. The Medicare Fee Schedule says the code is worth $100. If the contract is 120% of Medicare, then, of course, they're going to pay you $120 for that service. So when you're considering a contract, think about the things you do the most, the services you provide the most. Think about the services that you like to provide the most, and that niche that your practice might have. So those are the services that you're going to pay particular attention to. We call it the bell curve, the codes that we do the most. Those are the services you're going to pay particular attention to when you look at rates and actually calculate them out to see if they're acceptable. Some contracts allow for carve-outs where you might do something unique or something that has a specific cost involved, maybe a supply charge or something like that. You might think about carving those out of the contracted percentage of Medicare or calculation to the RBRVS to a fixed rate. It's not incredibly common in primary care, but it's certainly not out of the question, and it's certainly something you should inquire about.
Like Todd said, carve-outs are rare in primary care contracts, but they do exist, and you should read your contract carefully to look for this language. We will cover carve-outs and this contract language more in Chapter 6.
Your own EHR is a great place to get information, live information that's incredibly accurate. Use it to find out the services that you do the most. Those are going to be the services that you're really going to kind of concentrate your efforts on when it comes to contracting. Don't forget about your behavioral health services. You want to make sure that you find out from the health plan how those will be paid as well. Look into your EHR, find out how many times you do it, and tell the health plan, look, I provide these services. How will I get paid for these services? Are they a benefit of the member, the patient's insurance plan? You're also going to want to find out if you're using the right codes, because different plans do it different ways. They may have a different way of accepting that service and processing it through their system. It may be the CPT code, it may be the ICD-10 code, but find out before you you don't want a surprise down the road. You want to find out from the contracting level where and how do they pay for these services, and frankly, how do they want to see these services come across in a claim. Being a part of this SIM initiative has really given you an advantage. You have a toolbox full of data aggregation tools that you can use and understand so that you can talk to the health plans. They have data too, but so do you. You want to use your data aggregation tools to understand your practice, to find where it is that you really do well, that you're able to lower the overall cost of care, to lower that per member per month cost to the health plan. It's that information and that knowledge that gives you leverage with the health plans, or gives you an ability to have a conversation with the health plan as a peer. So they have information, you have great information. Use it, understand it, and be prepared to talk about it. A great example of using those data aggregation tools is that pyramid where it shows the most expensive patients in your practice. It might be a very small percentage, but they're by far the most expensive, the most in need of services. Your ability to help manage those patients, to maybe even go out and have them come into your practice rather than waiting for them to come in, that's the kind of thing that's going to help drive down overall costs. By avoiding an emergency room visit, by applying behavioral health services to get out in front of a chronic issue that really might be exacerbated by a certain circumstance. Those are the things that your management of patients is going to be valuable to a health plan. And it's something you should talk about in that contracting process. One additional great source of information are those cost and utilization reports. That information and your understanding of that information is crucial. Understanding where the health plan's costs are per patient, especially those patients that are very expensive and have a lot going on. Understanding how you're utilizing the payer's network of other providers. So where are your patients going? Are they, we call them frequent flyers, where they may end up in the emergency room quite often? All of that sort of information, using it to identify those patients and put together strategies to mitigate some of those costs is incredibly valuable. Your understanding of it is incredibly valuable, and you want to make sure that the health plan in the contracting process gets it, that they understand that you're ready to play. You're working with them. They're a partner in this to try to lower overall costs.